Here we are. Welcome, everybody. Thank you for joining us for our October PT Month webinar at H&D Physical Therapy. Today, we have a group of outstanding PTs that are here to answer any questions that you may have related to physical therapy, rehab, wellness, fitness. We'll do our best to answer all questions. And if you want to pose it through the chat, feel free. Some people have submitted questions earlier, and we'll get to that. And so it's a total open forum. Whatever you have in mind, whatever is bothering you, whatever is aching you, we have about 55 minutes to get through it all. And I think we'll have plenty of time because people apparently are having trouble logging on. Before we get started, I want to just introduce our panel today. And then as I do so, you guys could tell us a little bit about yourselves maybe and your specialties and your background. Why don't we start off with Dr. Javier Benitez, physical therapist. You want to say hi, Javi? Give us a little info about yourself.
Yeah, hey everybody. Javier Benitez, grew up in New York, went to school at PT school at the Hunter down the block. Been doing this for 5 years. I was a personal trainer for about, since 2003. So I use a lot of that background to help me with exercise progressions and motivating people and keeping them accountable for their rehab. Yeah. Thank
you. What do you like to do in your spare time, Javi? How do you enjoy your free time?
I like cooking. I do lift weights. Let's see, museums, try new restaurants, that sort of thing.
Awesome.
Yeah.
All right, we're taking suggestions for restaurants at the end here. So give us your top 3, keep that in mind. Patricia, tell us a little bit about yourself. Where are you from? How long have you been practicing?
Oh, do I really have to say how long I've been practicing?
Yes, because that adds to your expertise.
44 years.
Excellent. So combined, all right, we're going to add these up, 44 and 5. All right, keep track, Greg.
Okay. So I am a born and bred New Yorker. And I went to school a long time ago, graduated when it was just a bachelor degree as the entry level. So you know how long ago that was. I got a master's in applied physiology. I worked for about 6 years in acute care. Started teaching at LIU, but missed treating patients, so started a private practice. So over the year, and in that private practice with just one other person, we sort of had to do everything. So I don't think I have a specialty, but sort of, jack of all trades, master of some, maybe. So,
what types of patients do you enjoy treating the most? What types of conditions are you into now?
I am doing a lot more neuro now, which I didn't do a lot of. I have always had some over the years, so I do enjoy that. I've, of course, a lot of musculoskeletal, mostly back and neck patients, which I would say I do a lot of also. So, but I've done a lot of ortho and sports things too.
And you're practicing out of which location now?
The Uptown.
Okay, 88th and Park. Javi, where are you again?
Midtown, 43rd and 2nd.
Okay. Thank you. All right. So, and Pat, how do you like to spend your free time? I know that you have a pretty big family, right?
Yes. I have 5 grandchildren who I like to spend as much time as possible with. And I have a very big dog who's over here lying on the bed. Hopefully won't make an appearance, but he might. And I really enjoy taking long walks with him.
Nice. Very cool. Thank you. All right. Greg Holstrom, co-founder, H&D Physical Therapy. Thanks for joining us today. Tell us a little bit about your background.
Hi, thank you, Aaron. And it's a pleasure being here tonight with everybody. I've been a physical therapist for 28 years and co-founded H&D 24 years ago. It's hard to believe. We co-founded H&D with the thought that we wanted to treat the whole person, not just the body parts. So I know everybody here who may have some questions or concerned about maybe a body part of theirs, but we look into the whole body and what's going on. And to give you a quick example of that, for those of you who can and are able, I just ask you to please stand up for a quick second and I'll show you what I mean. So if everybody stands up and just take your hands and let's just twist all the way over to one side. And then let's take your hands and just twist and turn all the way over to the other side. All right. Let's repeat that again. This time, I want you to do it, but let's lock your arches of your feet down into the ground. Cement your arches of your feet down into the ground. Okay, so I don't want any twisting or turning at the foot. So I want you to turn again as much as you can, and you probably feel it somewhere else in your body. You might feel your shoulder or your back being strained or your upper neck or something else, but it's not that area of pain that's the problem. It's because we locked the foot in the first place. So we kind of take a head to toe approach to where how your body is moving efficiently or inefficiently, and all of our staff does that. And so we believe that it takes about 45 minutes to 60 minutes one-on-one care in order to get that. So that's why we founded H&D, and more of a quality over quantity approach instead of a assembly line factory like a lot of other like medicine has become and healthcare has become. So that's about me, and want to hear more about all of you next.
Nice. Thank you, Greg. So if my math is correct, and I don't claim that it is, but it looks to me that we have just shy of 100 years of combined experience on here. And that's a lot of patients. That's a lot of hours. It's a lot of different conditions in the clinic. So we've seen pretty much about everything. So you guys could throw whatever questions you want to us, and we'll be happy to field them. Just a little bit about myself. My name's Aaron Huppert. I'm a physical therapist and physician liaison at H&D Physical Therapy. I work out of the Upper East Side location in Manhattan, and so my background is in sports and orthopedics, and I like to treat shoulders and knees and hips. I also see a lot of back and neck pain. I have a certification in McKenzie from the McKenzie Institute, but I like to use a little bit of every discipline. So let's get into it, and we'll start today. And feel free to. I see most of you have your videos on, and that's great. We'd love to see you when you ask the question. But I want to start with one of the questions that came through earlier today. It had to do with low back pain. Instead of me reading your question, why don't you pose it to the panel, and then we'll try to help you out.
Okay. I've had some back pain throughout my life and some spinal stenosis and this and that. But recently I had very bad back pain, and I went and had an MRI. And I learned that I have severe spinal stenosis this time because I had severe pain. And so and unfortunately I can't get an orthopedist appointment for a month. So I do back stretches every morning, but I do have lists of back exercises, and I don't know whether I should just be stretching or whether I should do strengthening exercises as well.
Okay. This is a very common condition. We see it all the time. I would say, at least in my practice, I would, of the low back pain patients that we have, at least half have spinal stenosis. And so we're very familiar with this condition. I'm going to pose the question to Patricia. So I'd like for you to get us started. Tell us how you would approach this condition, and if you have any recommendations or questions before that.
So Kathleen, do you have pain in your legs at all, or is it?
No, I don't have shooting pains in my legs. What I started was very, very severe pain for 10 days. It was horrible. And then one day it went away for a week, and then it came back again. Very severe pain, and then it went away. So now I just have plodding pain, but I know, it could be that bad again, which is why I'm going to see the orthopedist. But I have not had it going down my leg.
So, and there's no weakness going down your leg when you're walking. You don't feel anything like that going on.
Well, I can't walk as much or as fast as I normally do by a long shot because of the pain. I mean, it does hurt when I walk.
And it hurts across your lower back or in your buttocks, or where is it?
The first time it's on the left side and it shot into my buttocks. The second time it was just straight out. And now it's just the back itself. It doesn't shoot down either out or into the buttocks. It's just straight across.
And is it worse in the morning, or get better in the day, or?
The mornings are horrible. If I didn't exercise in bed, I don't think I could walk in the mornings.
And so what are you doing, like knees to chest stretches in the bed, and what else?
One knee over the other leg. And I don't know what it's called, where you lie down and you pull your stomach and butt in and go in the air, a bridge or something.
Okay. And you do that all in the morning before you get up? And do you stretch your hamstrings?
Yes.
And how do you do that? Is that in bed also?
Yeah.
With your leg up?
No, I think it's my hamstrings I'm stretching. I lie in the bed and pull both legs to the side and pull one up, and then I turn the other side and pull the other one up towards my butt.
Oh, so you're stretching the front of your legs.
Yeah.
Okay. So do you ever stretch the back of your side?
No.
Because that might be something you could add, because very often when they're tight, it really pulls on your lower back, and that can definitely contribute to your pain. To answer your question about strengthening, you're doing bridging, and if that relieves your pain, I guess you're engaging your core, and then you're lifting up. You're engaging your stomach muscles first.
Yes.
So that is a strengthening thing that you're doing.
Oh,
yeah.
Didn't know that. Okay.
So, I think anytime that you're engaging your lower abdominals and sort of trying to bring your belly button towards your spine, that would be fine, and definitely a positive thing. You should avoid, bending backwards, that kind of thing. But so I would say hamstrings, and go ahead and do stomach strengthening, but I would do it lying down with your knees bent, feet on the mattress kind of thing. I don't know. Anybody else have? Or do you have any questions about what I just said?
When you said the hamstrings, so what I'm doing is not the hamstrings, because I'm doing the front of the knee.
You're doing the quads, which is good also.
What is a hamstring stretch? Which one? I don't know which one it is.
So if you were lying on your back and you would bring your thigh halfway up, then I would say point your toes towards your knee, and then attempt to straighten your leg out until you just felt a gentle stretch, and hold that for 30 seconds and maybe repeat 3 times on each side.
Okay. Thank you.
Kathleen, have you had physical therapy for this condition yet? Have you gone through it?
It was 10 years ago when I had spinal stenosis, and I had the shots 3 years in a row. And then I did physical therapy after that. But I've been very fortunate because I haven't had the spinal stenosis since then.
Okay. And now, am I correct that you're going away and you want to make sure that you have a program that you can stay with?
Yeah, I'm going to Switzerland and London on Thursday, and I'm a little nervous, first of all, about sitting all that time. Well, I mean, I'll try to walk around, but I'm going to be gone for, what is it, 2 weeks. So I just wanted to know whether what I'm doing is right, whether I need to add to it. Just keep on doing until I see a doctor.
Yeah. Well, if I could, I want to come back to you. I want to hear some of the other panelists here, but maybe we can get into a little bit more of an evaluation here if we have time at the end, and we can maybe give you some more ideas on what to do while you're away. How does that sound?
It sounds great. Thank you.
Okay, great. All right. Why don't we go to the next person here, Nat Dershowitz. How are you?
Well, I've been better, but I'm okay.
Okay.
And I hope I will be better also down the road. They're talking about body parts. I'm having a shoulder replacement operation soon. Haven't picked the exact date. It's a reverse shoulder operation. And I have essentially 2 questions, both dealing with physical therapy after. First is, how long after the operation should I consider doing physical therapy? And how long in your experience does it take to be able to secure the range of motion, or at least a lot of the range of motion that I previously had?
Great.
When can I ski is the third question.
Great. That's really what it comes down to. When can you ski?
That's right.
Yeah, that's all people want to know. I mean, I'm happy to field this question, guys, because I'm currently treating 2 patients right now who've had reverse total shoulder replacements. And you'll be happy to know that the outcomes so far have been phenomenal. Do you mind sharing the name of your doctor? Because each doctor has a different protocol.
The doctor that's going to be doing it is Taylor at HSS.
Okay. Great. Yeah. So typically, to answer your first question, most docs like you to start anywhere from 10 days to 3 weeks post-op. Because in the first phase, you just have to allow it to heal. There's not much you can do. You're going to be in a sling, and you'll be doing a few gentle exercises on your own. But then once you start physical therapy, anywhere from 10 days, usually 10 days to 2 weeks is what we see. Then we start with the protocol that the doctor recommends. And it's usually very simple exercises, mostly hand, wrist, elbow, shoulder rolls, pinches, that kind of thing. Just getting rid of the swelling, getting rid of the pain, doing some massage, postural exercises, helping you get comfortable at home, teaching you how to do the exercises at home, that kind of stuff. And then, slowly the restrictions are then lifted over the course of the next 2 to 3 months. You'll be regaining most of your range of motion. Now, I'm sure that the doctor told you that you probably won't get your full range back, but the truth is you probably don't have your full range now. And so you'll get back, I would say, most of it, 80% of it. The ones that come the last are the ones that you're reaching behind the back. That comes last. And so all the other motions, you'll pretty much have 3+ months. But at least that's what I've seen. And then skiing, again, like that's a question for the doctor. But when are you having it again? The surgery?
We haven't set the date yet, but soon.
Okay. So if you have it, let's say December 1, 3 months from there, you're in February. I mean, that's pushing it. I would say towards the end of the ski season, you'd probably be ready. But again, that's more the doctor's precautions,
What about other sports? Like right now, I cannot do a crawl when I swim. I can do a breaststroke. I cannot do a crawl.
Well, that
hurts. Huh?
The crawl stroke you'll be able to do. That's one of the beauties of this surgery, is that you'll be able to lift your arm up and over for the most part.
And tennis if I don't serve, or will I be able to serve?
It's your dominant arm, I'm assuming, right?
Yes.
Yeah. So
I can't serve with my other arm. I've tried. Doesn't work.
you'll be able to serve again. That might come a little bit later. That might be closer to 6 months, 4 to 6 months, but that'll be in time for spring. Now, again, you might not have full flexion, but you'll have enough for a nice slice serve.
So roughly how long do you think it'll take physical therapy to be in as good a position as I ever will be after the procedure?
So I would say like anywhere from 3 to 4 months is
Oh.
what you should like pencil in for PT, probably closer to 3. And then from 3 to 6 months, you'll be on your own, most likely doing the exercises that we've shown you. And so at 6 months post-op, that's when I'd say that you're going to be maybe 75, 80%. And then another 3 months from there, you'll get the next 5, 10%. So it's like all in all, you're looking at a 9-month recovery, but from 3 to 9 months, you're going to be very functional.
Okay. Thank
Yeah.
you. That's very helpful.
Yeah. Good luck. I mean, look, this surgery has been a godsend for a lot of people because I'm sure you're in a lot of pain at rest, and that goes away once you have the surgery. That's gone. So
Problem is, it goes away in one shoulder. I have problems in the other shoulder too,
Yeah.
which I'm not having operated on yet. So I'll have some pain in that one.
well,
But-
one of my patients is going back for her other shoulder in 2 weeks. So and like that's because she was so happy with the outcome so far. So yeah, so good luck, and if you have any more questions, I'm happy to answer them as you go. And consider
Does it
this.
make a difference which facility I use? The one I've been using is I use with Javier. So,
Yeah. Oh,
that-
I'm sorry, Javi. I didn't know you guys had a relationship, Javi. I would have.
Well, I couldn't recognize him because he doesn't have a mask on. If he has a mask on, I recognize him.
He's much
Javi,
better
do you
looking
want-
with the
Do you have
mask.
anything to add, Javi?
Right. No, I didn't do shoulders with him. I had
No,
sciatica.
we worked on those hamstrings. Yeah.
Right.
No, I mean, I thought you were very thorough, Aaron. Yeah, I mean, it's great that you've had some experience. I haven't seen reverse shoulders, so yeah, I thought it was very
What's
helpful.
pretty neat, sorry to interrupt. What's pretty neat with the reverse Nat, as you know, is that it was invented because of the rotator cuff damage that you have. So most people with a full thickness rotator cuff tear don't really do that well with a traditional total shoulder replacement because the rotator cuff is shot. So they came up with the reverse that relies on the deltoid as the prime mover for certain rotation movements. And that's why that's really going to be a staple of your program. As you rehab, you're going to build up your deltoid muscle because the rotator cuff is no longer going to be there.
Well, in my case, it's arthritis mostly, and the rotator cuff seems to be in, well, we'll see when he goes in.
Mhm.
But from the x-rays, it doesn't look so bad.
Oh, good.
But it's the arthritis that's there, and I wish they
Yeah.
could just put a sponge in there or something
Right.
else and leave me alone, but they don't want to do that.
Very good.
Thank you.
Okay, moving on. We have John here. Let me unmute you, John. How are you today?
Good, thank you.
Good.
To be on.
Yep, we could hear you.
Okay, I did send you an email just a little while ago. I had a little trouble logging on. But my issue is I had surgery for a torn medial meniscus on my right knee about 10 years ago. It was basically successful. Over the years, I've been able to do most of everything. No real running or tennis, anything like that. But over the years, off and on, with extra activity, I've been developing Baker's cyst. And it's been on and off. Occasionally, it lasts a little bit. And I've had one now recently, I'd say at least 3 or 4 months consistently without it going away at all. And my wife thinks the reason is because we just moved to a house and I'm doing a lot of work. So I'm very active in the yard and doing things inside, also crawling around and just repairing and what have you. And overall, though, I could walk a few miles. I do stairs. but I can't really do much more than that. And it does swell up on occasion where I have to take a little bit easy. So my basic question is, what kind of therapy could I do? I would say at least basically at home now to at least strengthen the muscle surrounding the knee to support it better. But more than that, are there any new therapies? Maybe I'm thinking medical therapies besides surgery. I really, really don't want to have another surgery in the near future. I'm not looking toward a knee replacement at this time. I could walk no problem usually. And again, I do stairs, so I'm active. So I don't see that in my near future, but I need to do something more to give me more support and enable me to just be a little more confident when I'm out there, not worrying as much.
Great question. Thank you for sharing. Javi, do you want to take this one?
Sure. Yeah. So what is your day-to-day? I mean, you say you're doing more things around the house. Are you kneeling? Are you gardening? Are you carrying things
lot
up
of
and down the
gardening.
stairs?
A lot of gardening around
Okay.
kneeling and housework where I'm repairing things. I'm climbing up, I'm going down. So I'm doing a lot of more limbering kind of activity than I might normally do day to day. As an aside, I also do a little bike riding, some exercise, and I can do that.
Do you notice any specific, any of those activities that tend to trigger more of the discomfort?
Well, let's say, for example, yesterday I bagged 4 bags of leaves in the yard, constant up and down and raking and what have you, lifting and falling away. And I noticed it afterwards. So during the activity itself, I was able to do things, but then later I sort of just had to take it easy. So I can't really say there's anything specific that would hurt it more, but just overall more activity, I think.
Yeah. Yeah, I mean, you can look at your mechanics for it. So, if you're doing something hundreds of times in a row, but you're doing it in a way that puts more pressure on your knee. Let's say if you're bending down, but your knees jut forward, as opposed to, let's say your hips going back, you're putting more pressure on the knee as opposed to getting the glutes, the hamstrings to take some of the brunt of it. So maybe looking into that can be a possibility. A lot of people that have knee issues don't have as strong hips. So making sure that your hips are limber, that you're doing some stretches for the hips, some strengthening, whether they're some squats, whether there's some bridging, that sort of thing, some basic things like that can take some of the pressure off of your knee. And just doing some basic strengthening. So if you're used to just moving your body weight around, if you're able to maybe add some resistance to it for some exercises, even if you're doing much less of them, let's say you're doing a squat with a little bit of resistance to it, it's kind of like having the same car with more horsepower. So you're able to get through the day to day, but that extra muscle can take some of the pressure and alleviate some of the just the discomfort from the repetitive motions that you're doing. Yeah. So are you one to stretch? Are you one to do exercises consistently?
I want to do some strengthening is really what I want. I find, especially because of COVID, I stopped doing more exercise than I had been doing. So I feel like my body is weakened. I need to rebuild strength.
Yeah, it's a great idea. I mean, a lot of what I tend to see is people either love to stretch or love to do cardio or love to strength training, but it's hard to find people that want to do at least 2 of those. So, if you're active already doing day to day around the house, you get some cardio in with your biking, that's great. So doing some strengthening can help you have some more of that, think of muscles as shock absorbers. So take some of that pressure off of your knee, off your hip, that sort of thing. And I would just start with some basic things. If you've done bridging before, we talked about it earlier, Pat mentioned it, where you're laying on your back, knees are bent, raising the hips up. That's going to get the back of your legs strengthened, your glutes, your hamstrings. You can do laying on your side where you raise a leg up a few inches just to get some of the glutes involved. Some people have done clamshells before if they've had back or hip issues that may be familiar. Have you tried any of those before?
I in the past, but it's been a while, so it's out of my memory at this point, so to speak.
Yeah, and it's not a bad.
I need to get started. I need that activation to get started again.
Yes,
really what's going on.
exactly. Yeah, and I like to start people simple, even if it's something you've done in the past and it seems on the simpler side. It's a great way to be aware of the muscles you're trying to engage. So as simple as a bridge could be, it still allows you to be aware of the muscles you're using, and then you can translate that to more of your day-to-day things. So when you're going up the stairs, you can say, oh, now I'm aware from when I do the bridges that I feel the glutes working. Now I can feel it when I'm going up the stairs and lifting this, or when I'm picking this up from the floor, things like that. And that's it's a great place to start. Yeah, and I would keep it simple. A few rounds of 10, once or twice a day. See how you feel after 24 hours, and then you can gauge it from there. It's we're always, as therapists, always trying to figure out how to increase the progression without causing that flare up. So it's a balancing act. Everyone's different. Everyone's at different levels. So everyone has different experiences as well. So just starting off on the light side and just slowly increasing will be helpful. And a lot of it's just the consistency. So even if you don't have to do everything on day one, just do a little bit and just slowly, consistently keep up with it, and you'll see the results.
Okay, thank you. I don't know if Greg, if you remember me, but a couple of years ago, I was in the Second Avenue facility for sciatica, and it was great. I did my therapy; it was wonderful, it cured me 100%. But if I could find that I have a package of exercises for that, would that translate into this? Do you think? If I take some of those for strengthening.
Correct, because I think we were talking about your hips back then as well, and I think it's going to help your back and your knee. Essentially, for Kathleen as well, maybe I could just show you a quick exercise. Maybe that could help both of you.
But just using them as Javi was saying with the squat. Let me get this down a little bit lower. But if you're squatting and you're squatting this way, you're pushing the chair away, and it's putting a lot of stress in the knee. And if you're going to bend, they tell to bend your knees to help protect your back. If you do that and you go to bend, you're gonna hurt your back and you're gonna hurt your knees. What I like to do is just tell folks to walk up into the chair with your feet underneath and try to squat without pushing the chair away. So you really activate the butt that way, as opposed to squatting this way, which will put stress on your knees and your back.
Before you sit down, that was a great demonstration. Can you also demonstrate a standing hamstring stretch for John and for Kathleen? Since
good point.
They both might need it, since if John, you have a Baker's cyst, this might really help.
Yeah, that's a great point. Which I have terrible hamstrings, so hopefully you guys can do this better than me. Do you want to do with the leg up on the chair, or do you like a standing deadlift stretch?
No, that's good. That's okay. Perfect.
So just the leg up.
Can we see the other? Can you tilt the camera a little to your left so we can see your stance leg? Good. Notice how his hips are supposed to be pointing straight away, but Greg's a little tight here. So I would suggest using a stool for someone who has
this is
a little high, but what you want is your hips to be pointed straight away, and you want to bend from the hips, kind of like yeah.
And what I would also say, the hamstrings are 3 muscles, so you want to twist. You could floss it at the toe in, toe out, or from the pelvis in and out. Because like Aaron said, my hamstrings are killing me now, so I can't. I should have done that with a little bit lower chair, so I could have demonstrated it better. But I'll see Javier after this.
I got the ice ready.
Thanks.
Thank you.
Could I just give John a little bit of advice too? Since you have the Baker's cyst, it means that your joint is irritated by what you're doing. And probably mostly the squatting down and up that you're doing, and maybe if you're doing more stairs. So you might want to just think about those activities and avoiding them. until you see that the Baker cyst and the swelling is going down. Because the one thing about the knee, when it swells, it inhibits the quadricep. It's like your body telling you, don't move. So it's hard to keep your quads, your muscles in the front of your thighs strong when there's an ongoing swelling in there. So, the first thing is try to maybe limit some of your activity to avoid anything where you're really bending your knee past like 90 degrees, because that's kind of where you start to get into trouble. And then you can just try to do regular tense your thigh and do straight leg raises, which you might have had before in a PT program, where you really focus, like Javier was saying, focus on tightening around the kneecap before you lift, and then lower it slowly. Just start with really simple things.
Great. Thank you, everyone. I want to maybe see who else has any questions here before we come back and circle back to some of our other patients here. I see a woman, Gali, who is muted right now. Or are you with us? Yeah, am I saying your name right? Gali or Gail?
Got it.
Yes. I saw that you came on a little earlier, but I don't see your video on. So if you can hear us, just chime in whenever you're ready, if you have any questions. Okay. Kathleen, why don't we come back to you for a minute and see if we can offer some further instructions. But what I'd like to see you do is I want to have you stand up, and I want to see your range of motion a little bit. Great. So I'm gonna
maybe lower the camera.
I'm gonna pin you actually. Yep. Yeah, lower it a little bit more. Good. Okay, maybe step back if you can. Good. And turn to the side. And I want to see you slide your hands. If you can tilt the camera down a little bit more. Good. Great. I want to see you just slide your hands down your legs, keeping your knees straight. See how far you can go. Just a couple of times. It's comfortable and as you feel like going, and then come back up. Good.
It has to be straight.
Your knees should be straight, yeah. Try again. Okay, and then roll up. Good. Now I want to see you place your hands back on the small of your back here and push your waist forward as far as you're comfortable going. Mm-hmm.
Can't go
See
through.
that? Let's see how that feels a couple times. Good. Any pain with that?
It's all the further I can go is to right here.
Okay.
I mean, I could go further, but it would hurt more.
Okay. Okay. Does that bring on your symptoms when you go further?
Makes it hurt. Yeah. Makes it hurt.
I mean, because, yeah, is that the pain that you're describing? Like when you lean backwards?
What I'm having now is all the time low level pain. I should also comment, I take meloxicam every day.
Mm-hmm.
That helps the
Sure.
When it's this kind of pain, it helps. The other pain, it didn't when it was really bad. But
Right.
for the regular back pain that I'm having now, it helps it. But I still, I'm limited. Like if I walk, I'm a typical New Yorker. I walk fast and I do a lot of errands and I can't do that because it hurts.
Got it. Hands on your hips. Let's see you do some rotation here. Yep. That's good. And then side bend this way. And the other way.
Yeah, I can't go as far as I used to.
Try some hip circles like this.
Don't worry, none of us can move like we used to.
And the other way.
Yeah, this isn't good either.
Okay. And then let me see you
Not
just.
this is horrible pain, remember?
Sure.
you know,
I understand.
I had horrible pain in the 8-9 range before. This is
Right.
just thudding pain, and if I do certain things, it gets worse. But it's not the horrible, horrible pain. It's just miserable pain.
Got you. Can you do just last thing? I just want to see you just do high steps. If you can do some marching. Good.
This is okay.
Good.
Going very slowly in one place.
And just a final question, like you can have a seat if you want. Thank you. Did you recently have x-rays that showed stenosis, or is this something that you just know that you have?
Well, I said I had an MRI.
Okay, I'm sorry, I missed that.
I have very bad arthritis all over, and I've had operations in a lot of regions. So I have a rheumatologist that I go to. So when I had the horrible pain, I called her up and she ordered an MRI. And so that's how I know.
Right.
Spinal stenosis. And she said at that point was when I was in horrible pain. And she
Right.
said the stenosis is very severe. And she said, I don't want to tell you what orthopedist is going to do, but it's possible that you may end up having to have an operation, which is the last thing in the world anybody wants to do.
So I think Pat was right when she was describing like some certain exercises that might help. And for stenosis, it's usually flexion-based exercises. So what that means, flexion means like knees to chest on your back, or child's pose like in yoga, or otherwise known as prayer stretch. All things aim to open the spine to relieve the stenosis. However,
somewhere that I'm supposed to, I typically sleep on my side in basically the fetal position. I read somewhere that that's good for it. Is that true?
Yeah, if that's comfortable, that's fine. Now here's where it gets a little interesting, and I'll have some of the other panelists chime in on this, but when I see patients with stenosis, unless it's like very severe stenosis where there's very little room for that nerve to exit the spine and you're getting radiating pain, what we find is a lot of times like these patients are stuck in a little bit of flexion because that's what helps relieve the pain. And what I like to do is try to restore a little extension, because that's what you need when you're doing your errands and you're walking around. And so what I saw from you is that you did lose a little bit of extension. So if I were to be working with you in the clinic, I would work to try to restore some of that within your pain-free range to help improve your posture and allow you to do some of these exercises that you need extension for. Now, I'd love to hear from some of the panelists to see like what they think of that as well, that approach.
I agree, Aaron. I think it's so that I remember I saw the MRI, you shared it. I don't know if it was L5S1 or L4, L5, but that area you don't want to extend that much. But there's a lot above and a lot below you need to extend. So just more in your thoracic spine to extend, but without extending too much in the low back, or getting the hips to extend, or even your calves to stretch. So when you're walking, you just get better stride. So it's not all being stressed into that one area that's already being irritated and flared up. I'm not a big supporter of lumbar braces or girdles, but sometimes it's to help you get through this trip for the next couple of weeks, maybe just something to help protect that one area. Possibility, but not something long-term. You want to use your abdominals, which are your built-in stabilizers.
I did get
it might be a Band-Aid for just to get you through Thursday without irritating.
Lumbar brace. I did get a new lumbar brace when I went to see my rheumatologist, and we talked about the MRI. And I don't wear it much, but it does help sometimes.
I'm just thinking you're going to be wheeling that cart behind you, and it's going to pull you more into extension and some other things that might you're extending in the wrong spot right now. And I think after several weeks of therapy, you'd extend in the right spot, which would be very helpful. But just I think in the short term, we'll try to be a Band-Aid. And we do telehealth too, so
You what?
across, we do telehealth, so we could have actually have a more formal session even from Switzerland, I guess.
Right.
Pat, I think, works 24/7, so her time.
Yeah. I do a lot of telehealth.
Yeah.
But yeah, I agree with Aaron that you really do, you want the extension above the place that's where the most stenosis is. And I see that you are a little flexed forward in your middle spine. So one of my very favorite exercises is to lie on the bed with your knees bent, feet flat on the bed, engage your lower abdominals, and then just take your arms and go straight back. And while you're lying down in that, and then just as far as you feel comfortable, hold it for 10 seconds and then just repeat.
Am I supposed to be lying down when I move my arms back or sitting up?
Yeah, lying down with your feet, with your knees bent and your feet flat on the mattress,
Yeah.
and engage your lower abdominals and then just kind of stretch back.
Okay.
And that keeps your spine pretty neutral. Nothing bad's going to happen. I will say go slowly, because if you've not done that, the muscles will rebel if you yank too hard. So just go slowly, stop it when you feel the pain, or stretch. If you feel a stretch, you're stretching. You don't have to force it. Just hold it. And that's a very relieving exercise for a lot of people.
Great, thank you. I will say just a little bit that I've done now has made my back hurt more.
Yeah.
That's blame Aaron. That's Aaron's.
Yeah, you could blame me. Anything you want to add, Javi?
Yeah, so I agree with what everyone's saying, but also keep in mind your body position, your awareness of what you're doing throughout the day. So I exaggerate, if someone's going to do the exercises every day, they come into the office and see me 7 days a week, but then they go home and they sit on their couch for 3 hours, and then they go walk a hill and things like that, you're still going to find that pain. So a lot of times with this back pain, it's from being in this non-ideal position throughout the day and then just jumping up and trying to be active. So, be aware of, how you're sitting when you're at dinner, when you're reading, when you're watching TV, how much are you sitting, things like that. So, you can do everything right. You can come into the clinic, you can do the exercises, but then if you fall into this slumped over position or you have a non-ideal chair, then it's not going to help out nearly as quickly or as well. So.
Thank you. I spend a lot of time at the computer, and so I do try to remember to sit up, but I am back and forth with my nose to the screen and back. But
Right.
that's
Yeah. So
good point.
even sometimes just putting on a little alarm or something just to reassess every 20-30 minutes just to see, am I is my nose up against the screen? Have I taken a break lately? Am I sitting up tall? Am I pulling forward? So all that stuff helps. And then eventually it's just more, it's just easier and it's more automatic. You don't have to do that as much. Yeah.
Thank you.
Thanks, Javi. I see, Gali, I see you're on the screen now. Can you hear us? Okay, good. I'll ask you to unmute, and you'll be our final case today. How are you?
Well, I have a lot of the issues that Catherine has. I do walk a mile a day, but in the middle of the night, I do feel lower back discomfort. And I don't do much aerobic or strength training as I used to do because of COVID. I go to the gym because of it. But I'm wondering, the walking, even though it's 1 mile up and down hills, it's obviously not enough. I'm in my 80s. So I'm not doing enough to strengthen lower back. And I do spend lots of time reading and Zooming all day long. So it's just what Javier said, it's counterproductive, I guess.
Okay.
I
have some.
So much to sit so much and then to walk for a mile and then go back and sit again. So it's to his hurt.
Do you do any other like stretches that help relieve the pain from time to time?
Say that again. I'm sorry. You break.
Are there any positions are there any positions or movements that you do that help alleviate the pain?
Yes, what Pat was suggesting, some of those exercises,
Mm-hmm.
and the child's pose, I think, helps a lot.
Mm-hmm. Mm-hmm.
But I just started doing that because your Zoom your Zoom invite made me realize, wait a minute, maybe I better get in shape for this session. So I think that incentivized me to do something.
Yeah, I think that like most people, you would benefit from a comprehensive program that doesn't have to be complicated. It can include a couple simple stretches and a couple simple strengthening exercises that I think would really help put you in a better position to do walking, because walking alone, especially hills, can be problematic. So did you go for therapy at all for this at any point, or this is new?
Well, I've been seeing Mary for 20 years, but I have every 5 or 6 years when there's an issue on your 43rd Street location. I've been a patient of hers for, how long has Mary been there? Over 20 years? A long time.
Yeah.
But I haven't been there in 5 years. So a review would be probably a good point. Thank you.
Yeah, I think so. And it doesn't sound like you're going to need many sessions just to get you back on track.
Yeah.
Does anyone else have any suggestions?
I'd just like to, just in generally speaking, your backs and your knees are just are being victims of other parts of your body that are not doing their job. And so when you're blaming them for the problem and giving them all the attention, I would just say, don't give them as much attention. Start thinking above and below a little bit more. John, your hips and your ankles and your core, and Gail and Kathleen, your hips and your thoracic spine, and just to see wherever else, because if you're zooming a lot or being forward and you're down, just flexed a lot, and then you try to go and walk up hills and big steps, you're just going to be that low back is just going to get a lot of extra strain and stress, whereas your hips have the opportunity to help that back and somebody
Well,
else's parts. So
if I did like 10 minutes warm up before the walk, like squats, would that be a little bit more productive?
Yeah, yes, possibly. And I think what Pat was saying too, I think to just, especially if you've been sitting for a while, and then the squatting after sitting for a while may be a little bit tricky, but maybe you may want to do what Pat was talking about earlier, of just try to get some extension up here to kind of open yourself up. Maybe those bridges just to extend your hips a little bit more. So squats, maybe, but I would say if you've been sitting for a while, you've been in the squat position for too long, you're probably wanting
okay, thank you.
Go into that. Whereas the squat warm up might be good. And John, if you want to come to my house and do some leaves, you're welcome to. We could practice over the weekend, and be lucky. Gardening's almost over, but you just gotta before you start doing a lot of that bending. That's for you. I would say that would be a good warm up for you to do. Would be that squat. Before you go do your gardening, because your knees are just saying enough, that too much. But you have the gluteus maximus is a big ass muscle. It's a big ass muscle for a reason. That's why they call it the gluteus maximus, and a lot of us don't use it enough. So
Thank you.
Thank you, Greg. Thank you, Pat, and thank you everybody for participating in today's session. This was the first of its kind, and we want to do more of this, maybe get some other PTs and specialties involved. But I think this was great. And it's probably best that we didn't have too many other participants, because it took us about an hour to get through 4. So that's the H&D way, right? Right.
Yeah, that's true. 101. And it's a good point. Maybe we got to limit it to 6 participants or something.
Right.
Yeah.
We'll see. Or I'll break up into rooms or something like that.
And a big help. Thank you. Thank you.
I wish you all the best. But
All right, yes.
Thank you, everybody,
It's good to
again.
see you again, John.
Thank you.
All right. Take care.
All right, thank you, everyone. Thank you.
Take care, be well, and we'll see you soon, hopefully again next month. So look out for the next webinar. Everyone take care.
all right.
Thanks again.
Bye.
Thanks,
Bye.
Pat. Thanks, Greg.
Thanks,
Javi.
Aaron.
Thanks, Javi.